Good afternoon, everyone. Welcome to Cancer Reach, a live session on prostate cancer awareness. We have Dr. Krishnamani with us, one of the leading medical oncologists from Hyderabad. Cancer Reach is a channel developed for the patient awareness and arrange better access to the caregivers and patients, right access to the treatment at the right time. So, September is a prostate cancer awareness month. We have Dr. Krishnamani with us to enlighten us on some basic information about the prostate cancer and help us in diagnosis and care after the treatment, during the treatment, and everything is going to discuss with us. Welcome to the session, sir.
Thank you. Thank you very much.
Sir, on this prostate cancer awareness occasion, we would like to know some basic information about the prostate cancer. So, generally, what is the prostate cancer and what age it is generally detected?
So, first of all, good afternoon to all our viewers. So, Cancer Reach is basically an initiative to spread awareness on cancer, and on Cancer Reach, we come out with these kind of live sessions every month based on the Cancer Awareness Month. So, as already said, September is the Prostate Cancer Awareness Month. So, today's talk will be focused on prostate cancer. Now, coming to the question, prostate cancer is one of the most common cancers seen in men worldwide, including India. So, the most important risk factor for prostate cancer is age itself. So, basically, this is a disease of the elderly. You see prostate cancer when men become old. Once they cross the age of 50, the risk of getting prostate cancer increases. So, it is not a disease of the very young. We do not see that many patients below the ages of 40 years. It's a disease of the elderly. And as one grows old, the risk of developing prostate cancer increases. And prostate cancer is a very common cancer which we see in the general population.
Thank you, sir. Thank you very much. And doctor, what are the general signs and symptoms of the prostate cancer?
So what we should understand is prostate cancer per se can be asymptomatic in people. So somebody who is elderly may probably have prostate cancer, but may not have any symptoms. So that is very common. So what people have learned over a period of many years or decades is elderly people, for some reason, after they die, they undergo an autopsy. Just consider that they probably had a road accident or heart attack or something, some unnatural cause. When you do an autopsy, in the prostate in elderly people, they have found prostate cancer. This cancer has not troubled that person during the whole lifetime. So what it goes to show is all prostate cancers are not symptomatic. So you don't need to have symptoms in all patients. That is, some patients may harbor or have prostate cancer without any symptoms, and they may die due to age or other reasons. Number one. Number two, some people may have a screen detected prostate cancer. So that means they are asymptomatic. Again, they have no symptoms, but due to these master health checkups, they do routine PSA. PSA is a blood test which is called prostate specific antigen. So they go and get the PSA done as part of the master health checkup program. The normal PSA value should be less than 4. If your PSA is 5 or 10 or 15, it is incidentally picked up. It is like you go for a master health checkup, you have no symptoms, but your PSA comes high, and then the evaluation starts that do you have prostate cancer? So that is again asymptomatic but screen detected prostate cancer. The third way which patients present is lower urinary tract symptoms. That is, they may have elderly patients having difficulty in passing urine or burning in the urine or hesitancy, or they're unable to hold the bladder by the time they go to the washroom, frequency we call it, or urgency, etc. So this is a sign of local or locally advanced prostate cancer. But also remember, all elderly people or most elderly people will have such symptoms. That doesn't mean they have prostate cancer. More common than prostate cancer is a benign or a non-cancerous condition called BPH, or benign prostate hypertrophy. That is, the prostate becomes big as you grow old, it presses on your urinary bladder, because of which you have this difficulty in passing urine or dribbling or frequency. So that is one symptom, but it is more common in BPH. BPH is not cancer, but even prostate cancer can present like this. And the last way patients present is when the disease spreads to other organs. Prostate cancer commonly spreads to the bone. So when it goes to the bone, sometimes the elderly men can just come to the first time to the clinic with severe back pain. They do an MRI or a PET scan or a PSMA scan or a CT scan. The bone has a disease. Then PSA is done. PSA is elevated. Biopsy is done, and they're proven to have prostate cancer. So to summarize, prostate cancer can be there inside asymptomatic people and it may never be detected during their lifetime. Or number two, they do a PSA for some reason as a master health checkup and that is elevated and then the workup starts for prostate cancer. Or they can present with lower urinary tract symptoms, but all lower urinary tract should not be thought of as prostate cancer. BPH is more common. And finally, they may present with metastasis to bones commonly when the patients present with severe back pain.
Doctor, as you said, majority of the time it is asymptomatic. Are there any suggestions from your side to detect the prostate cancer early?
So what we have to understand is two things. What are the risk factors? The most important risk factor itself is age. So we cannot stop growing old. So as we grow old, the risk of cancer increases. Other than that, there are certain risk factors which have been put forward like diet and nutrition, but diet has no strong relation. There is some reports to suggest that increase in red meat can increase the prostate cancer risk, or if you reduce, if somebody takes less amount of vegetables, the risk may be high, or taking lycopene or antioxidants reduces the risk, but the diet doesn't have a consistent relationship. So what we suggest is usually, and what I suggest or most people suggest is have a healthy, balanced diet. So that is a risk factor. Two, most important is age we spoke about. Another risk factor which we should understand is a genetic risk factor. So the genetic risk factor is some patients who have a gene called BRCA2 gene, which is seen in breast and ovarian cancer, have a risk of other cancers like prostate cancer also. So if a family member is having BRCA2 or a family member is having prostate cancer, our risk may probably increase if we also have that gene. Coming to screening, how are we going to identify these people? So in average risk people like you and me, routine PSA screening is not advised because please understand, PSA is a blood test. It is elevated not only in prostate cancer, it is also elevated in infections in BPH and other conditions. So a rise in PSA doesn't mean you have prostate cancer 100%. So by doing PSA in the routine population, we may identify some people with non-cancerous conditions also and unnecessarily traumatize them, and they may undergo a lot of workup for cancer, number one. So that is why it is not advised as a routine screening test for prostate cancer. Another reason is, suppose somebody is 85-year-old, has heart problems, is a bypass surgery patient, you do a routine PSA, normal PSA is less than 4, his PSA comes to around 4.1, then we will suggest, or 4.2, we say that no, PSA is high, we are suspecting prostate cancer, we do a biopsy and all that. We pick up prostate cancer very early. There is no need of treating such patients because this person is already 85, 90 years. He has other problems. This low risk prostate cancer is not going to trouble him in his lifetime. So that is another reason why routine screening is not advised. That is, by detecting the cancer early, you are not helping that person because his age itself is so high that treatment need not be given and treatment will not be useful. So to summarize again, PSA is a routine test which is done in most labs and most hospitals, but it is not a routine screening test for average risk people like any of us. Those patients who have a family risk or those patients who carry the BRCA2 gene, PSA may be advised.
Age factor and genetic factors and other things which we have to keep in our mind when they have some symptoms, so then they will get cautioned about it.
Yes.
Thank you, doctor. And what are the stages of the prostate cancer? And what is going to be the prognosis? If it is diagnosed in the early stage, how long is going to survive? If it is in advanced stage, how long is going to survive? So can you please explain, doctor?
What what are the stages? We'll come to that first. The stages of prostate cancer, you can, it can be local, that is only confined to the prostate, or locally advanced. It can go to the nearby lymph nodes or surrounding areas, or advanced disease where it spreads to bones commonly or other areas. So these are the basic stages. Medically, we also try to categorize patients as having prostate cancer as very low risk, intermediate risk, high risk, or very high risk. So how do we classify patients into these categories? We need 2-3 parameters. One, we need the PSA level. Two, after the PSA, we would do a digital rectal examination to see how the prostate is when you put the finger and see if it is hard, if it is nodular, and we do a biopsy. So on the biopsy, we get a score called a Gleason score. So your PSA and your Gleason score will tell you in what risk you fall. So if somebody is a very low risk or a low risk and is a very elderly person, most of the time you don't need any treatment. So that is what we have to understand. So what we have to understand is this patient who is in a very low risk or a low risk, very low risk or low risk, that is, if the Gleason score is less than 6, or if the PSA is maybe less than 10, is an elderly person, has multiple other health issues, prostate cancer is not going to kill them. So you can safely leave them alone. When you come to intermediate risk or high risk, you have to treat these people. How we treat, we'll come to that later. But before that, as part of staging, what we also need to find out is when you're going to treat somebody, you have to identify what stage it is. So for stage, what all do we do? So what are all the tests we do to diagnose and stage? So as we discussed, one is a PSA. Two is a digital rectal examination. Three is a prostate biopsy to get a score called Gleason score. Based on these two factors, you come to the risk of the patient. So the next question is, if I'm diagnosed with prostate cancer, where all has my disease spread? So what are the imaging you will do or the scans you will do? So first test which is usually done is a prostate MRI. A prostate MRI is very useful even in low risk diseases where it will say that there is only minimal disease left, minimal disease present, or in high risk where it clearly tells us whether it has spread to the lymph nodes. Apart from this, to know the spread to other areas, there is a particular scan called PSMA PET scan. It is not your regular PET CT. It's a prostate specific PET CT where they use a specific radionuclide. So that is called a PSMA PET CT. In the PSMA PET CT, we get information about the prostate gland, the surrounding lymph nodes, and also the bones and other major organs. So based on these 3-4 tests, PSA, biopsy and Gleason score, prostate MRI, and PSMA PET CT, we accurately stage somebody. Now the whole point is, do you have very low risk or low risk where you can safely leave the patient without treating if their life expectancy is small? If the life expectancy is extremely good, you find it out in a 60-year-old man and you're expecting that the person is going to live for like 20-25 years, then because this disease is small, surgery is an option. Now, when it comes to intermediate risk means the PSA is more than 10 but less than 20, or your Gleason score is 7. For these patients also, treatment will depend based on your life expectancy. If my life expectancy is very short, don't treat. This disease will not trouble you. If life expectancy is good, about 10 years, then either surgery where you remove the prostate or radiation are treatment options. For high risk and very high risk, usually radiation is advised. So what we have also summarized here is what are the treatment options. One treatment is nothing for elderly patients who have limited life expectancy, who have minimal disease. Second treatment is surgery in low risk patients or certain intermediate risk patients. Third is radiation in intermediate risk and high risk patients. In advanced cancers, it's a different ball game. surgery is usually not advised in advanced cancer patients. Because prostate cancer is a disease which is a hormone driven, because of the male hormone called testosterone, we block the testosterone. So once you block the testosterone or remove the testosterone, the PSA falls. And in advanced cancer patients, what we do is we either remove the testis surgically, or from the testis, the hormone which is secreted is blocked by an injection called GnRH analog. So by this, what happens is your testosterone level comes down, PSA will come down, and the disease will start getting better. So in advanced cancer patients, first this thing is to reduce the testosterone medically or surgically. On top of that, we either add chemotherapy or other medications, which are tablets like abiraterone or enzalutamide. These are the names of the tablets, which will increase our response and increase the survival of an individual in stage 4 cancer patients.
Stage 4 cancer and stage 3 and stage 2, now we understood, doctor. And doctor, there's a question from Mr. Vasudeva Rao. He's asking, is prostate cancer is curable?
Yes. So if you have followed any of our earlier videos, or even if you have seen information on cancer, please understand any cancer is curable if detected early. That is the catch, number one. Number two, when it comes to prostate cancer, the layman should understand, the common people should understand, prostate cancer is not deadly in everybody, number one. Prostate cancer doesn't need treatment in everybody. We just discussed that. Elderly people, minimal disease, don't treat them with their limited life expectancy. So when I'm not treating a cancer which is there, obviously it is not that severe. And for those cancers which require treatment, like low risk or intermediate risk or high risk, they are definitely curable. To answer it another way, if you look at the 5-year survival for local or localized prostate cancer, is more than 95%. So I think it is close to 97% or so. So what it goes to show is it is curable, extremely high survival rates. What has happened is because of rampant screening. As part of master health checkup, many people get a PSA done nowadays. We are able to detect disease very early, and the pros and cons are always there, but people do get treated early also at a very early stage, and that makes the disease more curable.
Sir, there is another question from Mr. Ramchandra. So how long do I need to do follow-up after the treatment? Do my disease come back?
So any cancer technically has a chance of coming back. Okay. So once treatment is completed, you are called every 3 months or every 6 months for the first 2 to 3 years. For prostate cancer specifically, what we do is we do a serum PSA test. If your PSAs are normal or our PSAs are declining, then not to worry. Once you cross 5 years, we technically say you're cured, but still would ask you to come with a PSA maybe once every 6 months to 1 year. Why we do a PSA is, if the PSA starts increasing, then we start suspecting that you have disease recurrence. So you will be on follow-up. The test which is done is usually a PSA. If it is stable or falling, we need not worry. If it is increasing, we will start evaluating. And once it is 4 to 5 years, they are usually cured, and we ask them to come once a year with a PSA for follow-up. Mahesh, you are not audible.
Sorry. There is a question from Mr. Atul Sharma. He's asking, one of my relative got diagnosed with prostate cancer 5 years back. Now he's in the hormonal treatment. So does he need to continue the treatment for a long time, or can stop the treatment?
So continued treatment depends on the stage of the disease and what kind of hormonal treatment we are. So one hormonal treatment, as I told you, is the GnRH analogs, which is called by the name leuprolide commonly, which is given once every 3 months or a 6 months intramuscular injection. That is to reduce your testosterone. Other hormone tablets which we use commonly as hormone are a medicine by name bicalutamide. So many of the times patients are continued on bicalutamide indefinitely. So if it is intermediate risk or high risk, we usually give leuprolide for around 3 years. If radiation has also been given beyond 3 years, we don't give leuprolide. But if it is advanced cancer, leuprolide is continued every 3 or 6 months. So I presume he has advanced cancer and is doing well. His PSA is under control. And that's the reason he's probably, if at all he is receiving leuprolide, that is the reason he's probably getting leuprolide the way he's getting.
There is another question. Sir, how much does it cost for the treatment of prostate cancer if anybody is diagnosed?
So prostate cancer treatment is not that expensive, thankfully. So cost depends on whether we are talking about surgery or radiation or hormone injections or hormone tablets. So let me talk about advanced prostate cancer or medical oncology part of prostate cancer, which I deal with. Now the leuprolide injections come for probably 10,000 a month or even less, 10,000 every 3 months or even less. So it's very inexpensive. That's an injection given once every 3 months. Coming to the tablets like abiraterone and enzalutamide, which we use in advanced prostate cancer, they too come for somewhere like 10 to 15,000 a month or even lesser than that. Earlier, they used to cost 80,000 to 1 lakh close to 4 or 5 years back. So the costs have come down significantly. One of the main reasons for the costs in cancer and specifically prostate cancer to come down significantly is the availability of generics. So generics or biosimilars are molecules which we find in the market, which is similar to the original molecule. So because of India being the pharma capital of the world, the advantage is we get many of these medicines prepared by multiple Indian companies at a much, much, much lesser cost. So a monthly cost of treatment should not cost you more than 10-15,000. Chemotherapies too are not that expensive. They would probably cost you maybe 20,000 or 25,000 per cycle. So immunotherapy is anyway a different ball game. We use it in prostate cancer, not that commonly, but for completion's sake, immunotherapies are a bit expensive. They would go in a few lakhs of rupees a cycle. But otherwise, most cancer treatments in prostate cancer are not that expensive. Most medical oncology treatments are not expensive.
Sir, there is a question from Mr. Rajkumar. Are there any diet changes required if anybody diagnosed with a prostate cancer? Or is
No.
there any lifestyle requirement also, lifestyle changes also required? They're asking this question.
Not needed. We just spoke about that. There's a lot of data on diet in prostate cancer, but most of the data is not, it's observational data. There is no hard evidence saying that you do this, you will get prostate cancer, you don't eat this, you will not get. But people have said that increased in dietary meat can probably cause, reduced intake of vegetables can probably cause. So what I usually suggest is have a balanced diet, good amount of protein, carbohydrates, vitamins and minerals and fat. All this myth that sugar increases prostate cancer cells or eating rice or anything white in color increases cancer risk, it's all not true. So your balanced diet, your staple diet, home food, cooked fresh food should be taken in regular quantities. And with regarding lifestyle, we advise people to have a walk every day, 15 to 30 minutes for 5 days a week if possible. And that's about it. Do not obviously smoke, limit alcohol, avoid alcohol, no tobacco chewing. All this has risk on other cancers too. And preferably stay slim. Obesity is better avoided because not only cardiac or heart issues or hypertension and diabetes, but also certain cancers are linked to obesity. So it is better to maintain an ideal BMI or a body mass index, or in simple words, don't be fat or don't be obese.
Thank you, doctor. There is one more question from Mr. Rajkumar, and he's asking one more question. Is surgery mandatory for every prostate cancer diagnosis?
No. So we spoke about this again. Very low risk or very early stages, elderly people who have multiple other problems where the prostate cancer is not going to trouble those people. You will call it watchful waiting. You will not trouble them. No treatment is required. Other people where you think the disease is progressing very slowly, we call it something called active surveillance, where we keep doing the PSAs frequently. Again, there no treatment is required. In high risk and advanced cases, obviously surgery is not required. So surgery is required in a very small subset of people who have early disease or intermediate risk disease. More importantly, the patient should be fit for surgery. If I'm an elderly man on dialysis, I am unfit, I am having heart issues, lung issues, anesthesia and risk is all very high, then obviously I'm not a surgical candidate. So my disease should also be intermediate risk or maybe high risk, intermediate risk, probably intermediate risk, and I should be a surgically fit individual. Then surgery is advised. But most elderly people, as we discussed, would not need any treatment if their life expectancy is small. We call it watchful waiting. And the advanced cancer patients would anyway not be treated surgically, they would be treated medically.
Thank you, doctor. Thank you very much. I think in the last half an hour, you have covered it for the patient and as well as the caregivers also. Thank you very much for your kind support. And we wish you good luck for your cancer reach. To give the access to the more and more number of patients and caregivers to access the right treatment and right time. Thank you very much, doctor.
Thank you so much for attending and thank you so much for listening. Thank you.